Good evening, everybody. Today we are going to have an important lecture on corona and vaccines of corona. And I invite OPA President, Engineer Sant Senator, to give a welcome speech as well as to introduce our lecturer today on behalf of OPA and Engineer Sant Senator, to give a welcome speech as well as to introduce our lecturer today on behalf of OPA and Senator, to give a welcome speech as well as to introduce our lecturer today on behalf of
Thank you, Dr. Parakrama.
OPA and Senator, to give a welcome
Good afternoon to all of you, ladies and gentlemen, who are joining this seminar Parakrama as well as online. I'm extremely delighted to participate in this very important seminar organized by the OPA jointly with the Government Medical Officers Association in collaboration with the Health and Nutrition Committee of the OPA. We all have been impatiently waiting for this seminar, considering its importance and relevance to the current situation. I must mention here with gratitude the support given by the GMOA for organizing the vaccination program for our forum members, which will take place on 13th Saturday at the Castle Street Hospital from 9:30 am to 12:30 pm. Ladies and gentlemen, today's presenter is Dr. Anand Vijayavikrama, a well-known personality in the medical profession. Dr. Anand Vijayavikrama is a consultant physician of the National Institute of Infectious Diseases. I very warmly welcome Dr. Anand Vijayavikrama on behalf of the OPA. Also, I take pleasure in welcoming the convener of the Health and Nutrition Committee, Dr. Parakrama Warnasurya, and the General Secretary, Ms. Ruchira Gunasekara, and all of you ladies and gentlemen who are joining physically and online. This seminar is being live telecast on the GMOA YouTube and the Facebook. Also, the full recording will be made available in the OPA website for your reference at any time. So now it's my pleasure to invite Dr. Anand Vijayavikrama, the consultant physician of the National Institute of Infectious Diseases, to deliver his presentation now for the benefit of our participants. Thank you. Over to Dr. Anand.
Good afternoon, everybody. First, I would like to thank the Organization of Professional Associations and the Government Medical Officers Association for inviting me to talk on this current and important topic. If I may welcome everybody with the traditional greeting, Ayubowan. I slightly changed the topic because I thought this is more important or more current. Is there any, with this crisis, do we have any hopes? These are the number of cases as of a month ago. This slide is about a month old. The world had more than 100 million cases. and now of course it has gone up. And there are deaths by more than 2 million cases by that time a month ago, and now of course everyone knows it has gone up further. And all these countries, the US, India, Brazil, Russia, UK, the number of cases are soaring up. You can see how the number of cases are going up since the beginning of this pandemic, as well as the number of deaths. So as of end of February, the daily deaths worldwide amounted to almost 18,000 per day. If you look at the historical estimates, at the beginning of this outbreak, the China reported a death rate of about 3.4%. It varied from area to area and ranged from about 2% to 6%. However, the important and significant thing of this was the number of deaths in the admitted or hospitalized patients. That was 15%, and that was unprecedented. When you look at the clinical studies done for various drugs in this pandemic, you would note a similar or a higher death rate. The first one is a famous trial called Solidarity Trial, conducted by the WHO, where they tested several drugs. And in that, the mortality rate was around 12% of admitted patients. Then the next one is where they tested a drug called Remdesivir in the US. Again, the death rate was ranging from 7 to 12%. Then there was another famous trial or drugs study done in the UK called Recovery Study, where they tested dexamethasone and other drugs. And there, the mortality rate was ranging from 22.9% to 25%. So almost 1/4 of people who got admitted there died. So one of the challenge we are facing as clinicians is the lack of treatment. So is there any hope in this? Since the beginning of this pandemic, number of studies testing various medicines have been conducted. Some are still going on, many are still going on. By early March, just within 6 weeks of identifying this virus and the pandemic, almost 400 studies, clinical studies, were going on worldwide. And by December last year, this has gone up to more than 4,000 studies, where many drugs were being tested. So among those are various antiviral drugs, antibacterial, anti-malarial, so various type of drugs have been tested. However, still we have not got any drug which can cure the disease. The only drug which has shown some benefit is the dexamethasone, which again has only a limited benefit. One of the main reasons for this, contributing to this, is the unknown pathogenesis, or if we talk in simple terms, we exactly do not know still what changes occur in the body due to this virus or infection of this virus. How the lung change, we know the lungs are getting changed. We got people get something like pneumonia. If you do a chest X-ray, we can see a lot of changes in the lungs or CT scan. However, how that happens and why that happened is not fully understood. Because of this involvement of lungs, the respiration or breathing becomes difficult, and then a lot of people had to be connected to ventilator machines. So we needed more and more ICU beds. We needed more and more ventilators worldwide. If you look at the figures in the US, the general production of ventilators per week is about 700 before this pandemic. But by April, it had gone up to 7,000. So that is how the effect of this pandemic affected. In spite of this, the number of people who are dying had been quite large and significant. This editorial in JAMA, where they talk about the excess deaths in the US, and this is a figure showing the number of deaths, how the number of deaths were going up in the UK. By early this year, by 3rd of January, UK recorded 75,000 deaths. And by early February, it recorded 100,000 deaths. So in many countries, thousands are getting infected, thousands are dying, hospitals are overflowing, and in many occasions, the necessary protective equipments are running out of stock, and doctors, nurses, other health staff were also getting infected. And this has affected the psychology of the people, the doctors, nurses, ordinary public. This has created changed the psychology. This article published in the BBC described this as the threat of contagion can twist our psychological response to ordinary interactions, leading us to behave in unexpected way. The writer goes on, the writer starts saying, rarely has the threat of disease occupied so much of our thinking. For weeks, almost every newspaper has stories about the coronavirus pandemic on its front page. Radio and TV programs have back-to-back coverage on the latest death tolls. And depending on who you follow, social media platforms are filled with frightening statistics, practical advices, and gallows of humor. And the author continues to say, this constant bombardment can result in heightened anxiety with immediate effect on our mental health. But the constant feeling of threat may have other more insidious effect on our psychology. Due to some deeply evolved responses to the disease, fears of contagion led us to become more conformist and tribalistic, and less accepting of eccentricity. Our moral judgments became harsher and our social attitudes more conservative. So what are the effects we see? There was discrimination of patients by the society and even health facilities, criminalization of COVID positive people, and then again closing down of factories, offices, schools, movement restriction, economic recession worldwide, and use of internet, and so on. In Sri Lanka, as we all know, the first patient was found detected on 26th of January. That was a Chinese national, and the first local patient was diagnosed on 10th of March. By early August, we had about 3,000 cases with 11 deaths. People who are coming out from various countries were quarantined. Then on 19th of March, the airport was closed. And there was direct involvement of His Excellency the President, and there was a task force headed by the Director General of Health Services and the Commander of Army. And there were key committees, and there were key decisions taken to lock down, close of airport, and then gradual reopening. So if you look at the number of cases during the early part of this outbreak in Sri Lanka, you can see the numbers going up slowly. There were clusters, there were small outbreaks, first in Kandakadu, then in army garrison, then we had another outbreak, but then after July, there were very few cases. So for 2 months, we did not have cases from the community. Then we forgot we have to live with COVID. And we relaxed. Not only the general public, ordinary public, you can see how the political leaders are relaxed. Some were not wearing masks. Those who were wearing masks also were not wearing it correctly. And this relaxation with other issues led to a bigger outbreak. By end of September, we saw this Minuwangoda cluster, and since then, this is how the case numbers are going up. Now there's a reduction, of course. So with this, the world believed that we will have to live with this virus, if not for years, at least for many months. the researchers have predicted various models, various scenarios, and these one such scenario written in the future article. What the writer says is a scenario assumed to be in June 2021. He says the world has been in pandemic mode for a year and a half. The virus continues to spread at a slow burn. Intermittent lockdowns are the new normal. An approved vaccine offers 6 months of protection. This is a scenario. But international deal making has slowed this distribution. An estimated 250 million people have been infected worldwide and 1.7 million are dead. So these similar scenarios were thought of. So we saw the health workers getting infected, which is a problem as far as I am concerned, and also as far as everybody is concerned, because if the health system gets disrupted, then we'll be in big trouble. So the priority identified was the safety of healthcare workers. Otherwise, we have seen already in many places, not only in Sri Lanka, in other countries too, there had been refusal to see suspected patients, refusal to attend patients until a negative PCR is available. There was unnecessary use of personal protective equipments, and so on. There were problems. This is an article published in the very reputed, highly reputed journal Lancet, and they talk about the priority of healthcare worker safety. The strategies in protecting the healthcare worker, for that matter, for anybody, is simple. The hand washing is the key thing. Then practicing cough etiquettes, avoid unnecessary gatherings, maintaining physical distancing, minimize touching surfaces unnecessarily, disinfecting surfaces, face masks wearing properly, and whenever necessary to use personal protective equipment appropriately. So these are the measures, the tested, proven measures to prevent one from getting the infection. This seems to be quite simple measures. However, the adherence is not very good for these measures. And then people start talking about other unproven methods, like taking various medicines and gargling the throat with very hot water and so on. So in a healthcare setting, this is how we attend to these patients. You can see a nurse wearing this picture from my hospital, wearing this full kit to protect herself, and the right side picture shows she's drawing blood from this patient. And this is a scene from our ICU. You can see several doctors and nurses were attending to these patients. In addition, what we try to stress in the healthcare system is not only to attend while ensuring the safety of healthcare workers, to give proper care and treatment to COVID positive patients as well as COVID negative patients. So this is a COVID patient who had a fluid collected in his lung, and you can see we were taking out fluid is getting filled into this bottle. Here I was putting a needle into the chest of these patients to take out the fluid. So while taking precautions, we do care of these patients, we do necessary treatment. On the other hand, when it is not necessary, we don't wear all these personal protective equipment. You can see one of our nurses handing over a packet of lunch to COVID positive patients. So they were wearing masks, the distance is more than 1 meter, that's enough to protect the healthcare worker or the nurse. And here you can see we were talking to some of these patients, COVID positive patients in the ward. These are our traditional, our hospital with the traditional old buildings with half walls, with very good ventilation and good light. And I believe that helped us maintaining or protecting our health staff, and not only that, to have better care for these patients. Not only that, we look into the psychological aspects also. This is this girl's birthday, so we can see one of the nurses have gone in with all these things made by our staff. So we try to look at their psychological aspect also. Here, at times, we allow these patients who do not have symptoms to come out and do some exercises, come out of the wards to do some exercises. Because those things can be done, because once again, I would like to stress upon these key methods of prevention: the hand washing, social distancing, practicing cough etiquette, and so on. And it is important to have good ventilation, good sunlight, and it is very important to avoid smoking. So we have to avoid these things like this, and instead, I think we will have to shift to our traditional system of greetings and so on. It's not only us, our Asian culture has this similar traditional greeting systems, which of course will help us to prevent getting this infection. In the hospital, we have other issues, preparing wards and things, and we try to maintain good ventilation in these places. Not only that is our experience, even the studies have shown that. And this is, I think, something which we have to think of, change our building structures, the architectural designing, and so on. This study done in China shows there was a 18.7-fold higher risk of transmission in indoors compared to outdoor environments, especially when combined with environmental factors such as poor ventilation and crowding in enclosed settings will lead to further increase in attack rates. So they have shown attack rates, high attack rates in long-term care facilities and workplaces, including factories, where many people spend several hours working together, dining and sharing communal spaces. So the authors of this article recommend, because crowded indoor spaces and gatherings likely will continue to be the driver of transmission, public health strategies will be needed to mitigate transmission in these settings. As part of pandemic response, we may need to consider fundamentally redesigning these settings, including improved ventilation, just as improved sanitation was a response to cholera. So our architects and engineers have to rethink and think of redesigning these things to improve ventilation and the sunlight. So as I said, it seems that we will have to look with this, live with this COVID for at least a year, if not more. So how can we respond to this? Are there any hopes? This probably will depend on how you look at this. We are in a crisis. Winston Churchill has supposed to have said, never waste a crisis. So can we use this crisis to improve the situation? It depends how you look at this. You can look at this in a negative viewpoint, like this, or you can look at the positive side of this. So I believe the crisis is a common thing in everyday life, and facing crisis, therefore, is a usual encounter. And if it is maybe short-lasting or might go on for some time, and it can be among few individuals, groups, but in this situation, the whole world is facing this crisis. We know there had been global crises like this. Probably something which we have heard of is the World War II. But there are country-specific things like the separatist war. We had the tsunami, which affected many countries. And I think how we face depends on many factors, like the magnitude of the crisis and the leadership and the expertise available and resources available and offered. I believe the most significant crisis situations we had over the last 100 years or so were the World War II, and then the JVP insurgency, separatist war, tsunami, and this present COVID crisis. I don't think many of us would have faced this World War II, not me definitely, but we know we handled this crisis of separatist war well, at least during the latter part of the crisis. And then the tsunami. Once again, the acute crisis we handled very well. As a nation, we rose together and we handled this acute crisis well. But did we handle the post-crisis period well? I don't think so. If we did, we would not have another insurgency if we handled the 1971 insurgency well. And even the 1988-89 insurgency, I don't think the post-crisis period was handled well. Even tsunami, though we handled the acute crisis very well, I'm not sure whether we can say we handled the post-crisis period well. So similarly, did we handle the post-crisis period after the 30-year-old war well? Of course, you can answer for yourself. You can think of yourself. So what can we do in this present COVID situation? The immediate acute crisis is over. Now it has become an ongoing thing. So we'll have to live with this and face this and come up against this. So the responses can be individual, maybe as a family or as an individual, and I believe there's an important role for professionals. Our hospital, the day the first patient was discharged, I believe it was a crisis when this first patient came. We were facing an unknown devil, of which we were not aware of the effects. We were not aware how dangerous this could be. Still, we had to take this patient and care for this patient, which we did successfully as an institution, as a team. So it was the teamwork which I believe which made us successful as an institution. And not only that, because of that, we got a lot of support from many organizations, especially the professionals. This is the Air Force. People were building an isolation ward for our hospital, and the CT scan room, which was built by a donation from a group of engineers from Morato University. And then this is the molecular lab, which was again donated by a group of professionals. And then we had the new nurses' quarters, donated with the guidance of General Dayaratnayake, and donated by some Sri Lankan professionals living in US. So as an institution, we got a lot of, I believe we are doing well, and because of that, we got a lot of support also, and we appreciate and we thank all the people who have supported as an institution. As a family, there can be many issues. This is an article by a clinical assistant professor of psychology who goes on to say about the COVID situation, the family resilience, the capacity for a family to weather and even thrive during adversity depends on a family's ability to balance stability and flexibility in changing circumstances. This work in progress calls for an attitude of we are all in this together and let's do the best we can. And I believe this is the attitude we have to have. We are all in this together and let's do the best we can. So there can be a lot of problems or issues for a family, parenting relationships, and there can be constructive dialogue using this situation. Then since the family members are in the same place for a longer period than usual, there can be issues, conflicts, and so there can be many issues within a family. So we have to address those. On the other hand, as individuals or as groups, people have had new thinking and innovations and inventions. This we see across the world. So these are some of the inventions done in some other countries, and you can see this a nice delivery robot, which was produced in the UK, which they used to deliver supplies. And these are some of the inventions done in Sri Lanka by our own people, supported by Sri Lanka Institute of Invention Institute. However, with these inventions, we have to think what we are going to do, what inventions are needed, what inventions will be useful, what inventions will be useful at the present and for the future. And I don't think a lot of inventions were focused on healthcare workers or health settings. And even though some were thought to be useful, this is a thing which was made to protect the healthcare worker when taking samples or PCR samples. But I personally don't agree with using this sort of things, because you use the human touch when you use this sort of things. So as a doctor, I don't want to use this. We are not using this in the hospital. I don't like using the human touch. This nice article was written by one Professor Ajit Dialvis. I came across, it was published in one of the newspapers. It was titled as Inventions Coming and Going, When the Dust Settles, What May We Have. So it writes saying COVID-19 and with the problem being an unprecedented experience, the outpouring of inventiveness too is perhaps unprecedented. The experience is across all countries. However, the nature of inventions definitely varies. In all events, the dust eventually had to settle and society moves on. Some may make the lessons count while some others slip back and history may repeat itself. Therein lies the lessons for us at this stage. And he continues to say, recession-inspired inventions and crisis-inspired inventions are aplenty, and interestingly, all those change the subsequent trajectory of the economy. A lasting impression is made if and only if the system embraces and appreciates the ideas of their worth. One big hope with the virus is that it would enable creating an ecosystem for the inventor and researcher to take the mantle of leadership for innovation. I think this is a good thing as professionals to think of. So we have, as professionals, we have a huge role in this for the future with this crisis. In their respective teams, the professionals are the leaders. So we can direct these innovations and inventions to be beneficial to the public, the mankind, and for the future. And then we have to initiate research. This is a huge opportunity. There is a huge opportunity for research, not only medical research. There's a huge opportunity for research in many, many arenas. And then as professionals, we can be examples to the public and encouragement to the public. And we have to be the advocacy to the public and advocacy to the government too. So I think the professionals have a huge role in these areas, and I think we should, I'm sure, I know that many professionals are taking these roles and doing a hugely important job, but I think still there's room for improvement, and still there's room for many of us to get involved in this. Then the vaccine. Is it a hope? Yes, it is. If you look at the vaccines, these vaccines go on several stages of studies. Before a vaccine is produced, there are several stages of testing these vaccines. Initially, they are tested on animals in the laboratory first, and then on animals like mice and monkeys to see the response produced by the immunity of those animals. And that is called preclinical testing. Then once it is established that a certain vaccine produces a certain amount of immunity in these animals, then it is tested in humans. First it is done in a small group of volunteers, healthy volunteers, to see the response produced by this vaccine. If that is also confirmed, or once that is confirmed, then we move to a stage called phase 2 studies or phase 2 trials, where we split people into two. One group will have the vaccine, one other group will not have the vaccine, and then we compare the two groups to see the efficacy of the vaccine. And once that is also proven, then we go to large-scale studies called phase 3 trials, or to look at the efficacy, the proper efficacy in large numbers, to make sure that these vaccines are effective. So in a nutshell, first we assess the immunogenicity or the production of immunity by these vaccines, and then the safety of these vaccines, and then the efficacy of this vaccine. After that, the vaccines are given approval by countries. First, generally it is given for a limited approval for a short period to see how good those are or how bad those are. And so many countries have given emergency authorization considering this situation based on preliminary evidence. China and Russia and some other countries have begun administrating of vaccines before detailed phase 3 trial data has been made public. Actually, there have been warnings of this early use of these vaccines, and then the approval is given by the regulator after going through the details of these studies, and then the full approval is given. At the moment, many vaccines are being studied. To be precise, 75 vaccines are being tested at the moment. Several have been approved. Pfizer, Moderna, AstraZeneca, Johnson & Johnson are approved and by the FDA. Our regulatory authority, National Medicines Regulatory Authority, has approved AstraZeneca vaccine and the Sputnik 5 vaccine for the use in Sri Lanka. The authority is studying the Sinopharm and the Bharat vaccine, and the authority has not approved these two vaccines still, because they feel still the data submitted to them is not adequate enough to approve these vaccines. Of course, when a vaccine is approved, in this approval process, the regulator or the medicines regulatory authority in our country, they look at the clinical evidence. They look at how safe it is, especially, and how effective it is. And those are the two main concerns of the regulator. However, there are other concerns too in other parties. When the Sri Lanka approved the AstraZeneca vaccine, this is a headline in the news India. Sri Lanka put Chinese COVID-19 vaccine on hold to rely on made in India AstraZeneca doses. So they have a political viewpoint. And of course, there is from certain quarters, there is pressure to approve these other vaccines too. However, the National Medicines Regulatory Authority is quite firm on this. Without any adequate evidence of efficacy and safety, it will not approve any vaccine. Just 2 days ago, my son showed me a YouTube produced by some media person interviewing a lawyer who goes on to say that this vaccine or the AstraZeneca vaccine has not been tested in Sri Lanka. There can be various other things. Actually, I stopped listening after a couple of minutes because a lot of rubbish had been told in that YouTube video. And unfortunately, there are a lot of other apprehensive comments made by people after listening to this. So no vaccine will be tested in all the countries. We have to go through on the evidence, credible evidence on tests done in other countries. Sometimes vaccines are tested in our country too. Now a couple of years ago, a dengue vaccine was tested in Sri Lanka also. Sri Lanka also was part of that. But that does not mean that we will approve the vaccine. So we have to go with the evidence, and unless there is adequate evidence, a vaccine will not approved by the regulatory authority. This is a news item in today's article. I don't know whether it is related to the approval or not approval of these vaccines. 4 NMRA officials removed. Your guess is good as mine. Anyway, coming to the aim of vaccination. The vaccination reduces the severity of the illness, and therefore it reduces deaths. It reduces the infectivity too, to some extent. If I get the vaccine, the chances of me getting the illness is reduced, but still it will not be completely eliminated. I might get the illness. However, even if I get the infection or the illness, the chances of me getting the severe illness or chances of me dying of the illness is very remote because of the vaccination. So if you are not dying of the illness, or if you don't have to be admitted to the ICU, putting on the ventilator, if that is not necessary, then you won't care much about the illness. Now everybody gets common cold, and we are not concerned about that because we don't have a problem with the common cold. Of course, 1 or 2 days we might have aches and pains, so running nose and so on, but you are not going to die of common cold, or you are not going to be ventilated because you got common cold. So if you have that sort of protection because of the vaccine for COVID-19, and that is what we want, then we don't have to be afraid of this illness. So that is produced by these vaccines. The vaccines which are approved give that efficacy, and they have been used in many thousands of patients, and it has been proven that they are safe. because it reduces the infectivity to a certain extent, it reduces the transmission also. So if you don't get the infection, it reduces the transmission. But on the other hand, you get the vaccine, that does not necessarily mean that you will not have the infection. Therefore, you have to vaccinate your older parents at your home. Because if they get the infection, then the chances of getting severe illness or death is higher with older people. And that is why the priority is given to older people, and also people with various other illnesses like the diabetes, kidney diseases, and so on. Because it reduces the transmission, it is recommended to be given to key economic institutions like the ports, the airports, and so on. So depending on the availability of vaccines, we will have to have a list of priority and vaccinate people accordingly. So as I said, we cannot go back to our old life after vaccination. Still the transmission can occur. And also we see new variants of virus occurring in many places, even in Sri Lanka. And some of these in one day or some day can be resistant to the vaccine. So the efficacy of the vaccine will go down when that happens. Fortunately, still it has not happened to a significant extent, definitely not in our country. So therefore we have to adhere to our usual precautions of hand washing, practicing cough etiquette, keeping social distancing, minimizing touching surfaces unnecessarily, having good ventilation, good sunlight, avoid smoking, and wear face mask properly. So these practices have to be continued in spite of having the vaccine, unless you vaccinate the entire population, which will take a couple of years. So it's good we have hope with vaccination, but still we have to adhere to these methods of prevention. Thank you. It's an old painting showing the traditional method of greeting, which of course, if we adopt, will prevent the infection from occurring.
Doctor, we have a few questions, I think, from the participants from online. But before that, if participants who are physically present here, they can post their questions ahead of them, so we can. Please use the mic.
Doctor, thank you for your presentation. I have a series of questions.
Yes.
First is that you mentioned that Sputnik and Seneca have been approved, but what is supposed to be better, Moderna and Pfizer, you have not commented on. Was it not tested in Sri Lanka, or?
No, the reason was now for a vaccine to be approved, somebody has to make an application.
Understand.
The agent who is bringing the vaccine, I mean, in this case of AstraZeneca, there was a company, I can't remember the name, and in the case of Sputnik, is the State Pharmaceutical Corporation. So they made the application, they got the details, all the data from the manufacturer, and the data of studies, and all were submitted to the NMRA. And I'm sure if somebody applies for the Pfizer or Moderna, they will be approved because there is enough evidence to say they are good. On the other hand, Moderna is still limited to the US. They are not distributing it outside. Pfizer is given to some countries, and in fact, I'm also in the committee in the NMRA. So we had a discussion with the Pfizer mother company, and we had a discussion regarding how they tested and all, and that looks quite good. However, they were not very interested in giving to or marketing it here, because probably the market is quite small and they have huge demand.
Right.
I
Second
think
question.
Mr. Gamaraj, can we allow a person?
Two more. Second
No,
question is
please.
that I took the jab, then I have the possibility of becoming an asymptomatic carrier.
Yes.
With that, could I easily disturb my home biobubble?
If your home people are not
Not, they are not,
vaccinated,
they are not.
yeah, of course it can happen.
Then third
The
question.
chances are less,
Yeah.
less than earlier, but it can happen.
Yeah, third and the final question. It is often rumored that second jab is more difficult or more riskier than the first. Is it true? Thank you. Thank you very much.
No, there is no risk in these things. It has been all these vaccines, the AstraZeneca we have studied in detail. The safety is very good. There have been no reports of serious side effects with the AstraZeneca vaccine, which is available at the moment with us. And even the other vaccines, the safety profile is very good. So the chances of having serious issues with the second jab is not there. But of course, some of the side effects can be more with the second dose. Actually, that was shown in with the Pfizer vaccine, not with the AstraZeneca vaccine. So it is unlikely that we will get more side effects with the AstraZeneca. Of course, with the first jab, some people got fever, body aches. But those are common with any vaccine. Those are common expected side effects of any vaccine. But nobody has got any serious side effects, so it's quite safe. And we don't expect to have worse side effects with the second dose.
Thank you, Doctor. I have 3 questions from online participants. Let me put these questions.
Sorry, I have to go.
Oh.
I have one last question to ask. Doctor, now does the vaccine increases the risk of the cancer patients? Do you give vaccine to cancer patients?
Yeah, we do give. Actually, it is recommended to them because some of patients like people with cancer, people with chronic kidney disease, people with diabetes, they are likely to have more complications if they get COVID. So it is recommended that for them it's better for them to take it rather than not taking it. And I know there are myths and rumors propagated saying that this create cancers, and so those are lies.
Secretary,
For
can I
cancer
ask
patients,
another-
sometimes you have to decide when to give the vaccine depending on what treatment they are on.
Can I ask the last one, or shall I? Is that okay?
Okay.
Thank you. Doctor, just to ask, nothing to do with COVID, but how do you deal with dengue and COVID at this point in time at IDH?
Well, fortunately for some reason, some unknown reason, the number of dengue patients went down drastically during the last 1 year, fortunately, too. But over the last 2-3 weeks, we have been getting some patients from pockets in and out of Colombo. So there is a possibility that it might increase, and if it goes up, then it will be a problem. We have a separate section for dengue patients, so we can manage. But if the numbers goes up, it's going to be a problem.
Thank you so much for answering questions as well as taking time off to come to OPA. Thank you.
Doctor, I have 3 more questions. First one, has Sri Lanka Health Authority done any research to test the AstraZeneca vaccine efficacy after vaccination? If so, what are the results?
Yeah, certain tests are being done. At the moment, it is an ongoing thing. Of the initial, as you know, the initial vaccination was done to healthcare workers, and after a month of getting the vaccine, the antibody levels and certain other tests were done in this group of people. So antibodies are one form of immunity, one form of showing the production of immunity in the body. And these tests are being done at IDH and also at the laboratory of Professor Nilika Malaviji at Sri Jayawardena University. And all this shows that almost all these people have got very good response as far as the antibody level is concerned. So it has shown very good results.
The second question, all the media and government authorities declare the daily deaths due to COVID-19. But when I present in isolation, people think that very high deaths, but if authorities present daily death comparative to all other death reported, example, death due to cancer, heart attacks, accidents, suicides, dengue, etc. Then we can see whether COVID-19 deaths are significantly high or low.
Yeah, yes, I fully agree with that. Of course, it is at the moment the focus is given only to COVID, which should not be the case. For that matter, I think yesterday or day before I saw a news item. There had been some 14 deaths over just 1 or 2 days due to road traffic accidents in Sri Lanka. So that is double the number of COVID deaths. So there are serious other problems which we have to pay attention. Yes.
Yes. Doctor, the third question is, why don't you explain about phase 4 trial stage, which is required to check the side effect, long-time side effects. Scientists suspect Sri Lankan people are undergoing stage 4 trial 2. Is it true?
I think Sri Lanka, at the moment, the vaccine had been given to little more than 700,000 patients, but the vaccination had been done for millions in other countries. So in that case, all these millions are in this phase 4 studies. Phase 4 is not a trial study level. Phase 4 level is a level where these various effects are reported. And sometimes, occasionally, there had been instances where certain drugs were removed from the circulation because of rare serious side effects. So those things were found in this phase 4 study. That's not a trial period. That's a study period where the immunity, now for example, we don't know how long this immunity lasts. It is assumed that it will last at least for a year or more, but we don't know this more is how long. So those things will have to be studied with the phase 4 study. And then there may be, when you give it to millions of people, occasionally you might come out with rare side effects. So such things will be detected in this phase 4 study. So the Sri Lankans are not guinea pigs in this vaccination thing. That is, in a nutshell, that is the message I think everybody have to understand. This has been tested properly in whatever approved, has been tested properly in many countries, and based on those tests we have approved this. So we are not guinea pigs. Otherwise I would not have taken it. It can have some effect, because when this trial, the scientists assumed a certain duration, and it was given, the second dose was given in most of the instances after 4 weeks. But then when it was practiced, it had been found in the case of AstraZeneca, there is better response when it is given after 10 to 12 weeks. So now it is recommended to give after 10 to 12 weeks after having the first dose of AstraZeneca vaccine. So these are decided with those are the things decided in this phase 4 study. So certain deviations are made based on the facts we find from this phase 4 level studies. So if you get, if one cannot get the vaccine at the second dose at the proper time, still there will be a response even if it is taken later, a month later instead of 3 months. Definitely there will be a response. But whether it is same as the one you get after 3 months we don't know. It may be the same.
Doctor, I have a very good question. This is the concern for all of us. This question says, dear doctor, can you explain the reason for variation of side effects person to person in wider range from nothing to severe fever, etc.? What implies this variation?
I think if you have 2 or 3 or more children, and if you think of the time they had vaccination, probably you can see and you will realize that all your children did not react to the vaccination in the same way. So it's the same. People respond differently to various things. for something, one might get angry and one might just ignore that sort of thing. So it's like that, like the mind, body also respond in different ways. Different people respond in different ways. So it's like that. So the response is different.
I think our president also want to ask.
Yeah, doctor. This is an extension to the earlier question. I have heard many people saying that, many people who have got the vaccination saying that younger people develop more symptoms than the older people.
After vaccination.
After vaccination. Is there any truth in that? And what is the reason?
No, there's no truth in that. For that matter, I'm not young now, I'm older, but I didn't get any reaction. So it varies. So some people, even very young people, got a lot of reactions, and very old people also got reactions. It highly varies.
Thank you.
Doctor, in comparison to other types of virus immunity, now what is the longevity of this virus immune systems? Because it is difficult to predict the longevity of the immunity. So, but comparing any other virus systems, what will be the longevity of the immune system for any person, maybe 1 year, 2 years, for not getting
now still this virus is just little more than 1 year old. So the experience and the knowledge we have also is that much. So we don't know how much this immunity will go on. There are predictions saying based on the antibody levels and so on, there are various predictions, but the accuracy of those are not very good. So only the time will tell us how long the immunity for the virus infection. When you get the infection, the chances of getting a second infection is less. We know for 6 months, we know the chances are very minimal to have a second infection. But then after that, that is because we have studied the 6 months period. Then maybe in another 2-3 months, we know how many people will get it after 1 year duration. So only the time will tell us how the immunity lasts.
Okay, thank you.
Doctor, I have a few more questions. Sorry. Doctor, can you give a guarantee that this COVID-19 will not lead to long-term side effect after 6-7 years?
Once again, I cannot give a guarantee. Only the time will tell us. So now, generally these viral infections are, the effects are short-lasting. For example, the dengue, people die of dengue. But then once you recover, then the effects, there are no long-term after effects of dengue. So similarly, like things like chicken pox, the long-term effects are very minimal, if at all. But then if you get viral infection like chikungunya, it had long-term effects. So there are occasions where viral infections had long-term effects, but generally not. So with this, we don't know what's going to happen, because still it's only 14 months old.
Doctor, permit us to ask few more questions. Is it possible to get Russian vaccine as second dose if the Oxford one is not available?
At the moment, a trial has been started in the UK to use the Russian vaccine as the second dose after giving the AstraZeneca as the first dose. So the results of that only will tell us how effective it is. Theoretically, it is possible, but practically how it is, we don't know. We have to wait for the results of that study. Without that, it will not be recommended.
Yeah, one more question. Doctor, what is the reason for not allowing this vaccination to be done by at least leading private hospitals?
The vaccine, when we, as regulatory authority also, we ask the manufacturers whether they will supply the vaccine to private agencies, and they said no, because the global demand is too high. At the moment, the manufacturers supply the vaccine only to governments. That's a policy decision they have taken. But with the availability of more and more stocks, probably it will be supplied to private parties too, but at the moment it's not available for that.
Look at into this one, I think all the countries is affected.
for the right now, the factories has to be tested by the PCR and other tests when you are doing the what is called working. In that case, we discussed with the minister. Anyway, the companies is spending money for the PCR, but company owners would like to get the vaccination by paying the money. So, can't you give attention to that area?
Yeah, then the agreement will have to be with the company and the government, because the company will have to pay the government. The manufacturer will not, the company will not be able to buy it from the manufacturer because they won't supply it. So if the government is willing to have money from the company, yes. So that's a different way. But I know that is being discussed at the moment. I cannot give an answer.
Doctor, one more question. If the person has affected the virus and recovered automatically, naturally, is there any scientific method to identify that person who has recovered or no need to vaccinate?
After the infection, the body produces antibodies that can be tested and detected. So that is why we know that after an infection, at least for 6 months, you are extremely unlikely to get another infection, second infection with COVID. So the questions come whether you need to get vaccinated. Yeah. So what has been, what the scientists say about that is better to have the vaccine. You will get a boost of your immune response. So the chances of getting another infection becomes very minimal even in the long run. So that is what is recommended.
So for the moment, I think one more question.
Before that, I'll ask the Doctor, you has mentioned some guidelines after the vaccination. I'm asking some silly questions. A lot of people say that after vaccination, don't get the drink or alcohol. Is it true?
It won't have any effect on the efficacy of the vaccine, because vaccine will produce antibodies and other methods of increasing immunity that will be there. Some people get various side effects with vaccines. Some people have got, and some people will get. So whether the drinking or the amount of drinking, whether those side effects will get worse or no, I don't know. I cannot say that. But it will not affect the efficacy of the virus. But the smoking is different. Smoking, if you smoke, the chances of getting the infection is high, and chances of getting a severe illness is high, and chances of dying is high. So if you smoke, chances of dying of COVID is quite high.
Doctor, we have a question. After completion of 2 doses of vaccine, can government allow Sri Lankans coming from abroad without quarantine if the PCR is negative?
At the moment, this is being discussed. There's a professional view, or from the clinician's view, saying that this should be allowed, but it is at the moment it is being discussed. So no decision has been taken on this up to now.
I think for the moment those are the questions that we have from one.
The minister and say that there's some Chinese vaccine. They would like to give the vaccine to Sri Lanka. What is the current position? In that case, they didn't accept it.
The Chinese vaccine, this Sinopharm vaccine, has been tested in 7 countries. Still, the studies are ongoing. Not in China, but in other countries like United Arab Emirates, Egypt.
Even Malaysia did it.
I'm not sure about the Malaysia. So in several countries it has been tested, and also China has donated it at least to 20 other countries. Donated it. And some of these countries who had the donation have later bought it. So when we heard that the China is willing to donate to Sri Lanka, we said we have to go through their data and see the safety and efficacy of that. So at the moment, it is in the process of being examined, and the initial data supplied to the regulatory authority was not adequate. So we have asked for more data. And once it is adequate data is there, and once the data shows it is safe and efficacious, only it will be approved.
Doctor, I think I have one more question. Doctor, don't you think that COVID-19 is not a notifiable disease in Sri Lanka, as mortality rate is less than 0.5%?
Yeah, the mortality is low for one reason is that we do a lot of testing and detect asymptomatic people. They are not patients. In many other countries, this mortality rate is calculated deaths per patients, but here we calculate it for the deaths per cases, and many of these cases are asymptomatic. So it's not the real mortality rate we are talking about. On the other hand, the problem with COVID is, even though the mortality rate is low, now there have been other corona infections like the SARS and the MERS coronavirus, which had a much higher mortality rate. Both those had much higher mortality rate, but their infectivity was not that much. The spread was not that much. But here the mortality rate is low, but it spreads like nothing. That is the problem. So because of that, we get, even though the rate is low, we get more numbers. So fortunately, we haven't come to that stage, but that is what we see in other countries.
Doctor, I like to ask one on behalf of all of us, for everyone. Is there any message that you want to give? Because as GMO has already, they are organized us to have our vaccines on Saturday. I must say, some are very scared to have this vaccine. Some have their second thoughts. So, as you know, we are all human beings. So,
yeah,
so
yeah, that's true.
Would you like to say something?
Yes, actually, I was aware of this fact that there are a lot of sort of fear generated against having the vaccine or about having the vaccine because of various myths, especially propagated through social media. So that is why I volunteered to take the first vaccine from the health sector to show that so that people can be confident. Because I was in the committee which assessed the vaccine, which has the data, so I had no hesitation in taking the vaccine because I knew that it's a safe vaccine. So it's a safe vaccine. So there's no problem in taking that. The only contraindication or the reason for not taking the vaccine is the allergy to components of the vaccine. Now, vaccine has, in addition to these viral particles, there are excipients and other chemical things. So if somebody is allergic to that, you can't take that. You will have to discuss with the doctor if you think you have some allergies. But otherwise, it's a very safe vaccine. So you don't have to be frightened of taking the vaccine. At the same time, I had to stress on the fact that taking the vaccine does not mean you need not take these protective measures that you have to adhere throughout.
Doctor, question to you. Now, almost a year ago, we saw a situation in countries like especially the Europe, Italy, UK, Spain, etc., where dead people were buried en masse. I don't know, cremated or whatever. Now, today, despite of hearing of this UK variant and South African variant, etc., we don't hear of that number of deaths being reported. How could that have happened? I mean, is there any possible explanation to that? Thank you.
I don't think the number of deaths have gone down like that. Yeah. So if you look at this figure, this shows how the deaths are going up in the world. So it was going up in the world. And also, this shows how the deaths are going up in the UK, the number of deaths over the period. So it is going up. It is. Yeah, that's exactly. So the media has shifted now the focus. Yes.
let's. Yeah, I think, thank you, Doctor. I think that's about, there are no other questions from the floor. We can wind up the program. And I think it's the time to show us our appreciation to Dr. Ananda Vijayavikrama. Now I invite our President, Engineer Shanta Senarath, to give token of appreciation to Dr. Ananda Vijayavikrama.
Thank you for that very informative presentation. I hope all of you were benefited by that presentation. And now it is time to propose the vote of thanks by our General Secretary, Ms. Ruchira Gunasekara.
Good evening, everyone. At the outset, our sincere thanks to Dr. Ananda Vijayavikrama for being here despite of your very busy schedules and for making such a important and valuable presentation on current status of coronavirus and vaccine. So thank you very much, Doctor, for the trouble you have taken to make this presentation for us. We are very grateful to Dr. Anuruddha Padeniya, President of GMOA and Chairman of Health and Nutrition Committee of the OPA, for initiating this program for us, and also for Dr. Parakrama Varnasurya, who is a convener of Health and Nutrition Committee of the OPA, for coordinating this event on behalf of the GMO and OPA. So also we are equally thankful to all the members who are present here physically as well as who participated online, who joined this program and by asking questions and which benefited all of us. So thank you very much. And also we appreciate the support given by OPA staff and the technical assistance given by Nilanga and his team. I thank you all once again.
Dr. Ananda, we salute for your service given for the country.
Thank you.
We salute.
Thank you.